Alright, let's dust off our memory and jump into cell biology and the organelles within the cell. Now, do you remember what lysosomes do? There you go. Lysosomes are organelles whose main function is to break down unwanted macromolecules using different enzymes. And a deficiency in one of these enzymes can cause a lysosomal storage disease. And this will result in the accumulation of sphingolipids as well as mucopolysaccharides in specific cell types. Now, here are examples of sphingolipids as well as mucopolysaccharide molecules. Now, their specific structure here isn't what's important, but there are many buzzwords that you'll need to remember for the lysosomal storage diseases. And a hallmark of these is the accumulation of metabolic byproducts. And since most of these are inborn errors of metabolism, they are most often seen in children. And why don't we see many of these diseases in adults? There you go, you've got it. They're just that bad. The lysosomal storage diseases are often deadly even at a young age, and they're all inherited via autosomal recessive pattern, except for Fabry's as well as Hunter's syndrome, which are both X-linked recessive. It's either going to ask you to identify the specific disease, inheritance pattern, deficient enzyme, the accumulated substrate, or the clinical findings that result from one of these lysosomal storage diseases. So to get that question right, you're going to have to take some time to learn these diseases and pay particular attention to what distinguishes one disease from the other. Now we're going to start off here with the sphingolipidoses, and these include Tay-Sachs disease, Fabry's disease, metachromatic leukodystrophy, Krabbe's disease, Gaucher's disease, as well as Niemann-Pick disease. And we'll go through each of these one at a time and talk about the important points. Now first up, we're going to talk about Tay-Sachs disease. And this is an extremely high-yield disease that can present with a cherry red spot on the macula. And you can see an example of this here, due to a hexoaminidase A deficiency. And an easy way to remember this is that Tay-Sachs lacks hexoaminidase A. And if you have a question talking about a lysosome with an onion skin appearance, you need to be thinking about Tay-Sachs disease. And another important point here is that Tay-Sachs disease has no hepatosplenomegaly, which is often used to differentiate Tay-Sachs disease from Niemann-Pick disease. Now next up, we have Fabry disease, which is due to a deficiency in alpha-galactosidase A, and this leads to the accumulation of ceramide trihexoside. And with that said, what were the two X-linked recessive lysosomal storage diseases? There you go. Hopefully you're thinking about Fabry's disease, since we're talking about that one now, as well as Hunter's syndrome. And all the other lysosomal storage diseases we'll cover are autosomal recessive. Now, Fabry's disease can present with angiokeratomas, which signify a capillary disorder, and you can see an example of these here. Now next up, we're going to talk about Krabbe's disease as well as metachromatic leukodystrophy. Now, metachromatic leukodystrophy is due to a deficiency in aryl sulfatase A, and it results in the accumulation of cerebroside sulfate. Now, as you may expect, with the accumulated product being cerebroside sulfate, you'll see nervous system issues, including central and peripheral demyelinization with associated ataxia and the development of dementia. And Krabbe's disease is due to a deficiency in galactocerebrosidase and results in the accumulation of galactocerebroside as well as cytosine. And in this disease, you'll see peripheral neuropathy as well as developmental delay and optic atrophy. And some classic pathologic findings for Krabbe's disease would be destruction of oligodendrocytes as well as the presence of globoid cells. And once again, both of these diseases are inherited via autosomal recessive pattern. Now next up, we have Gaucher's disease, and this is the most common lysosomal storage disease. And since it's the most common, you can bet that your chances of seeing this disease on test day are pretty high. So which enzyme is defective in Gaucher's disease? Great, that's glucocerebrosidase. And with glucocerebrosidase being defective or missing, this leads to the accumulation of glucocerebroside. Another important pearl for Gaucher's disease is how the cells look. Gaucher cells are lipid-filled macrophages that look like crumpled tissue paper, as you can see here. And you may also be presented with a young child who has hepatosplenomegaly, pancytopenia, osteoporosis, as well as aseptic necrosis of the femur. And once again, you need to be prepared to see a similar picture to this one on test day. Now next up, we have Niemann-Pick disease, and this is caused by sphingomyelinase deficiency, and it leads to sphingomyelin buildup. And what's a quick way to remember this? You need to use your finger to pick your nose. I know that's pretty silly, but it'll work when it comes to test day. Now in Niemann-Pick disease, you'll see lipid-laden macrophages called foam cells. And you may also see a picture similar to this one. And here what the question will say is that you have a fundoscopic exam which shows a cherry red spot. And if you hear this, Niemann-Pick disease needs to cross your mind. Now, an excellent way to remember which diseases have a cherry red spot is by looking at the hyphen. Cherry red is hyphenated, and so is Niemann-Pick, as well as Tay-Sachs disease. Now, it's also good to remember that Niemann-Pick disease is associated with hepatosplenomegaly, while Tay-Sachs disease is not. And for all you gunners out there, another cause of a cherry red spot is a retinal artery occlusion. And if you hear a question talk about a cherry red spot that occurs in an adult with vascular disease, you need to be thinking about a retinal artery occlusion. But if you see a cherry red spot that shows up in a young kid, you need to be thinking about Niemann-Pick disease as well as Tay-Sachs disease. Now next up, we have the mucopolysaccharidosis, which can be classified into two different yet similar disorders. The first one we'll cover here is Hurler syndrome. Now this is due to an alpha-L ironidase deficiency and leads to the accumulation of heparan sulfate as well as dermatan sulfate. Hurler syndrome is more severe of the two mucopolysaccharidoses, and symptoms include corneal clouding, as you can see here, as well as gargoylism, which is a joint and movement restriction which causes the children to look like gargoyles. And a few other things you can see here are hepatosplenomegaly as well as developmental delay. And now, do you remember the two X-linked recessive lysosomal storage diseases? As you can see, I'm trying to drill this point home because all the lysosomal storage diseases are autosomal recessive, except for two. And these two are Fabry disease as well as Hunter syndrome. And Hunter syndrome here is our last mucopolysaccharidosis. Hunter syndrome is a milder form of Hurler syndrome, iduronate 2-sulfatase, as you can see here. Now in Hunter syndrome, you're going to have no corneal clouding, but it is associated with some aggressive behavior. And an important point to notice here is that the same products accumulate in both the mucopolysaccharidoses, and this includes heparan sulfate as well as dermatan sulfate. Now, reading through all of these diseases from beginning to end will result in a lot going in one ear and out the other. I recommend trying to learn these in a methodical manner, such as making sure that you're very familiar with each disease before you move on to the next one, and going back and reviewing the ones you've already learned after you go through each subsequent one. So by the time you get to the end, you've already looked at the beginning a few times. A few other things you can try is to repeat the key points aloud or try copying them down onto flashcards. The big thing to remember here is to make sure that you know these, because they will show up on your test day. And again, when you're learning these lysosomal storage diseases, focus on the distinguishing characteristics of each disease. Fabry's disease is notable for angiokeratomas, as you can see here. And Niemann-Pick and Tay-Sachs disease both have cherry red spots on the macula. But Niemann-Pick's disease is associated with hepatosplenomegaly, where Tay-Sachs disease is not. Gaucher's disease is associated with bone necrosis, and ataxia is seen in metachromatic leukodystrophy. Hurler syndrome is notable for corneal clouding, and Hunter syndrome has no corneal clouding. And an easy way to remember that is that you need to be able to see to be a hunter. There are also several disorders that are associated with hepatosplenomegaly, and these include Hurler syndrome, Niemann-Pick disease, as well as Gaucher disease. And what three diseases should come to mind if you see an Ashkenazi Jew in the question prompt when referring to a lysosomal storage disease? There you go. You should think about Tay-Sachs disease, Niemann-Pick disease, and to a lesser extent, Gaucher disease. Well, alright, that'll wrap up this table. Now let's take a quick shot at a flash quiz. A patient is diagnosed with Gaucher disease. What is the deficient enzyme, the accumulated substrate, and the inheritance pattern of Gaucher disease? Well, the missing enzyme is glucocerebrosidase, which causes a buildup of glucocerebroside. And Gaucher's disease, along with all the other lysosomal storage diseases, except for Fabry disease and Hunter syndrome, are autosomal recessive. And remember, Fabry disease and Hunter syndrome are X-linked recessive. Well, alright, I guess that'll do us for the lysosomal storage diseases. See you in the next video.